Welcome back to Doc Talk with Monument Health. I'm your host, Mark Houston. If you spend time in the Black Hills, you share it with a few things that bite. So today, 2 conversations from the show worth hearing again before your next hike. First, Dr. Tamra Lemley and Dr. Kyle Lemley on snake bites, including why baby rattlesnakes can be more dangerous than the adults. Then, Dr. John Tronnes on spider bites and why almost everything you've heard about treating one is wrong. Enjoy the episode. So we have the Black Hills around here. Lots of people head up into the hills. Lots of people love to spend time up there. And I can't imagine the amount of injuries that can happen just up there, right?
Usually probably more from like falls or that type of deal. I would say, or like snake bites. We definitely
Is that still that's a big deal around here still?
It is still. I mean, even up on like M Hill, there's baby rattlesnakes. And baby snakes are more poisonous because they can't control their venom when they bite. So they'll actually release more venom at times than an adult snake might.
So when you guys see injuries like that in a kid, what typically, specifically for that, what are the steps you take? When a child comes in bitten by a snake, what happens?
Initially, it's, a physical exam, seeing how much swelling there is, assessing their pain, and then there's usually blood tests involved to sort of monitor to try to help figure out if they need an antivenom or not. Oh,
so an antivenom isn't automatic in some bites?
No.
Why is that?
I think just because of the risk of the venom itself, the antivenom can cause an allergic reaction as well. And so it's also a very expensive treatment and there's limited quantities of it.
So how do you keep kids safe around stuff like that then? What precautions do you recommend for kids that are up at M Hill or just in the Black Hills around rocks? And
a lot of it is just being alert, looking down, looking up, enjoying the scenery, but also looking down to where you're walking around. And not that we've always been great at this with our kids, because I will totally let them go out in like Chaco sandals and stuff like that. Yeah. But if you're going out hiking and things, closed-toed, hiking boots would be best, and long pants.
Okay.
Sort of deal would be kind of your most preventative. And then just, being aware of your surroundings and watching where you're going. I know we've stepped over a snake before on a hike, and then you're like, oh, wow, okay, we all need to look down a little bit more, pay attention. Thankfully, that one wasn't looking to bite us.
That one didn't care,
and one of our sons is like, I went down and I was going to grab the stick, and then it wiggled, and I was like,
oh my gosh.
Okay, great. That's great. I'm glad. Let's keep moving, please. Like,
at least it didn't rattle. So
yeah. It was like a black, it was probably like a water snake or something when we lived in Missouri, but anyway, I don't like snakes.
I'm fine either way. I guess if I see one, I'm not going to lose my mind, but at the same time, I don't want to see one.
Right.
I just don't want to be around one.
Right. It's not like mice. If I see a mouse, I'm like,
well, they can, because they're just creepy.
Right.
Alone. They get everywhere. What about one final thing for summertime? What about stuff like bugs and things like that we get? Do we ever have a danger of disease carrying bugs out here? I mean, ticks I suppose, could be one for sure.
Yeah.
Is there anything else that you got to watch out for?
I mean, technically mosquitoes anywhere could technically have like West Nile and stuff.
Is that still a big deal? Is West Nile still every once in a while? I know we get cases every year.
Yeah.
It still exists,
right,
for sure. It's not like epidemic proportion or anything, but it does still happen.
Okay. So are those the 2 big ones to watch out for, really? I suppose.
We don't have malaria or something in this area. So
brown recluse, spider bites would be.
Yeah.
But I haven't been here long enough to know if we have a lot of brown recluse spiders. So
I was bitten by one as a kid when I was about 8 or 9. And it's extremely painful.
Yeah.
Is what I'll let people know.
One of the sickest kids I had in fellowship was actually from a brown recluse spider bite. Yep. So they can definitely cause a lot of tissue damage and then a lot of breakdown of the blood cells and swelling and all kinds of stuff.
So if you see something like that, it's obviously don't, as a parent, you think, well, maybe if we can just get through the night with this and see how it looks in the morning.
It's not necessarily a bad decision. It depends on the case. Like if it's if there's a small bite, there's a little bit of redness, but there's not some like significant amount of pain, your kid's acting otherwise normally, it's not wrong to watch it overnight and see. But then area of redness continues to grow, they're complaining of more pain than you think they should, kind of deal, because sometimes those bites will not look so bad on the outside, but they'll be very tender around or they'll really hurt and kids will complain. That's when you should, at least get in to see your regular pediatrician, if nothing else.
Okay.
And where was the bite? Is it around the mouth? Is it on the neck? Those would be more concerning. than on your arm or your leg or whatever.
Oh,
Right.
that just
Technically, if it's inside your mouth, you should go see someone quickly.
immediately.
But yeah, if it's on your face, go get it checked out sooner rather than later, or even on your neck, just because it can the swelling that could be going on underneath that you don't really appreciate can cause your airway or your trachea to kind of close off sooner rather than later. So
Okay.
location, not just in market.
And those are the uncommon locations. You know,
Right.
most of them are going to be on your arms and legs. But yeah.
Okay. Spider bites is kind of interesting.
Yep.
Because it wasn't until recently, I don't know, maybe in the last 10 years, it was the first time I had ever seen a black widow spider in my garage. And at first, it's kind of shocking because you've always heard the dangers of these things, which I'm sure there are. They're not generally fatal, are they? Spider bites?
Not the ones around here.
Okay.
Are not typically fatal. Even with prairie rattlesnake bites, they're not overly fatal as well, unless the venom itself, gets directly into your bloodstream. And so with the spiders that we have here that can cause issues like black widows, brown recluse, and the snakes, which is the prairie rattlesnake, their venom tends to be a local issue, so it causes a lot of skin breakdown, tissue breakdown, and that can spread pretty easily locally and cause a lot of local swelling and issues like that. And so you'll see people who had a bite and their hand will swell up, or their whole arm will swell up, and you'll see tissue breakdown, big ulcerations of the tissue and wounds and blisters and things like that.
So with a snake or a spider bite, are they similar treatments when something like that happens?
Yeah, I mean, in both cases, you're going to want to seek medical treatment, right? And there are a lot of kind of old wives' tales about how to treat these things that don't necessarily apply.
I'm assuming the first one you're going to is sucking out the venom.
Don't suck out the venom. Don't make incisions over where the wound was. Don't try to suck out the venom. Tourniquets for bites. People will say like, tie off a tourniquet to the arm so it doesn't get to the heart and spread. Not true for the types of creatures that we have around here. There are some cases in certain species of snakes and things like that in Asia, Australia, where that might be reasonable to do, or some version of that. But here, it's essentially, especially like snake bite, which people are usually going to know right away that it happened. Spider bites so often when I see them, it's woke up in the morning and I see this, or I was out camping and maybe even a couple days later I started noticing this, because it can take a little bit of time for that wound to develop for people to actually notice it.
Okay.
But snake bite, get a bite. They recommend trying to get that wherever it got bit. Most of the times it's going to be a leg or an arm or hand, something like that. Get that in a neutral position. So put the arm in a sling so it's resting and not moving. The more muscle movement you're going to have in that extremity, it's going to work that toxin, that venom around and cause more tissue breakdown. Or if that leg, try to get it straight in a splint if you can, and get help so that they don't have to put weight on it, so they don't have to use that leg, and just try to get into an ER right away.
Boy, I don't think anybody has ever heard that that's what you're supposed to do. I think the wives' tales are so prevalent.
They're very prevalent, yeah.
That's so interesting that's how you handle this. I did, as a kid, was bitten by a brown recluse right here above my wrist, and it was it looked like about a half of a golf ball had flamed up on my arm, and without being too graphic, the stuff that came out of it was disgusting.
Yeah, and that's all just, the venom will just break down the tissue, so it just essentially liquefies and comes out eventually.
Yeah, it was terrible.
And those wounds can be prone to infection, so oftentimes it ends up just being proper wound care, either through your doctor or through a wound care specialist that a lot of hospitals have around here. And then antibiotics.
Yeah,
and,
I remember taking a lot of pills just to fix that. But it was, I remember the pain. It hurt. Yeah. I'm going to try not to be afraid the rest of the summer, but I'm still going to be tucking my pants into my whatever shoes I'm wearing for sure. All right, again, Dr. John Tronnes, thank you very much, Doctor.
Thank you.